Coffee's impact. A daily brew of benefits and potential concerns. Coffee, the world's most widely consumed beverage after water, is a complex drink with a multitude of effects on the human body. While many enjoy its invigorating aroma and taste, the true picture of its impact extends beyond the initial surge of alertness. Understanding how daily coffee consumption influences various aspects of health is crucial for informed choices. The power of caffeine. The primary driver of coffee's effects is caffeine, a stimulant belonging to the group of methylxanthines. Upon entering the bloodstream, caffeine readily crosses the blood-brain barrier, where it interacts with adenosine receptors. These receptors normally bind to adenosine, a molecule promoting sleepiness. By blocking these receptors, caffeine prevents the feeling of fatigue, leading to increased alertness and improved cognitive function. Positive effects of daily coffee. Moderate coffee consumption, generally defined as 3 to 5 cups per day, offers several potential benefits. Enhanced cognitive function. Caffeine improves alertness, focus, and reaction time. Studies suggest it can positively impact memory, learning, and overall cognitive performance. Mood and well-being. Coffee can elevate mood and reduce symptoms of depression. This effect is likely linked to its influence on neurotransmitters like dopamine and serotonin, which regulate mood and reward pathways in the brain. Physical performance. Coffee can enhance physical performance by increasing adrenaline levels and mobilizing fatty acids from fat stores, providing readily available energy for muscles. Reduced disease risk. Research suggests moderate coffee intake may be associated with a lower risk of developing certain chronic diseases, including type 2 diabetes, Parkinson's disease, Alzheimer's disease, and some liver diseases. Potential concerns of daily coffee intake. It's important to acknowledge the potential downsides of daily coffee consumption, especially when exceeding recommended amounts. Sleep disruption. Caffeine is a diuretic and can disrupt sleep patterns by interfering with the natural sleep-wake cycle. This can lead to insomnia, restlessness, and daytime fatigue. Anxiety and restlessness. Excessive caffeine intake can exacerbate anxiety symptoms in individuals susceptible to them. Feelings of jitteriness, nervousness, and even panic attacks can occur. Digestive issues. Coffee can irritate the stomach lining, causing heartburn, indigestion, and diarrhea, particularly for individuals sensitive to its acidic nature. Addiction and withdrawal. Regular coffee consumption can lead to dependence, resulting in withdrawal symptoms like headaches, fatigue, and irritability when intake is abruptly stopped. Individualized approach. The effects of coffee vary significantly between individuals depending on several factors, including genetics. Genetic variations influence caffeine metabolism and sensitivity, impacting how quickly the body breaks down and eliminates caffeine. Overall health. Individuals with pre-existing health conditions, such as anxiety disorders or high blood pressure, may need to be more cautious with coffee intake. Pregnancy and breastfeeding. Pregnant and breastfeeding women should consult with their healthcare providers regarding any limitations on coffee consumption due to potential risks for the baby. Conclusion. Coffee's impact on the body is a complex interplay of positive and negative effects. While moderate consumption offers several potential benefits, exceeding recommended intake or neglecting individual sensitivities can lead to adverse consequences. A mindful approach, considering individual needs and potential risks, is crucial to enjoying coffee as part of a healthy lifestyle.